sort of my elevator speech, and I can give you a little bit of maybe the nuts and bolts and also an elevator speech that won't quite. But for me, as you can see, our mission, we talk about sort of the parts of our mission: excellent health care for people who are in need, and it's Christ-centered. Our mission statement is spreading Christ's love through quality health care for those in need. You can see it there in our literature. So for me, it was very much a Christian ministry. That is the core of the motivation. And as I mentioned early on in my talk, that I'm not motivated from the standpoint of doing good works, although good works are a byproduct of what we do. I'm not motivated to solve some kind of dilemma that the government is in because they can't provide health care for everybody in the world, although that's a byproduct of what we do. I'm not motivated because I have some guilty conscience being a rich kid from North Atlanta that's got to go down and take care of poor people. I don't have a guilty conscience, so therefore I'm not trying to assuage some kind of guilt. That's not the motivation. The motivation is very much a Christian motivation that in my heart and mind, this is what I really sense that God wants me to do with my life, with the talents that He's given me, or the resources, or the contacts, or whatever. And therefore I'm trying to, in a way, leverage those kinds of resources and do this kind of work. And so that's the motivation. We're very much a Christ-centered health center that's trying to provide an excellent health care for people who don't have traditional access to care. And that the idea for this actually started in my heart and mind even when I was a medical student. Between my third and fourth years of medical school, I was able to go on a mission trip. And it was through the Christian Medical Dental Associates, which is a network of dentists and physicians and nurses and people in the United States who kind of get together to try to promote things that are important to them. And one thing they do is mission work. And I went to the Dominican Republic. That was my first sort of foray or experience in mission ministry type work. And from that point forward, I started really kind of searching my heart and mind, like, well, what does God have in mind for me? And I thought eventually that I would be doing what I'm doing. That God really put in my heart and mind a desire to be involved in some kind of an inner city medical ministry, serving those who don't have access to care. And I went through medical school, finished that. I went into my training, finished that. 1982, I went into a typical suburban pediatric practice, serving people who had access to care. They had the money, they had the resolve, they had health insurance, they had accessibility, et cetera, et cetera, et cetera. That wasn't what I thought I was supposed to be doing, right? Based on what I felt like God was leading me to do back, say, a few years before that. Okay? Was I missing the mark? Absolutely not. Because this was just basically a short stopover before going on to what we're doing now. As everything really is in life. I mean, everything is kind of like a path and way that way. So, but it took me a while to sort of figure this all out. In my heart and my mind, I knew that God wanted me to be involved in some kind of an inner city healthcare ministry, serving the people we do. I just didn't know exactly when that was going to happen or where it was going to happen. And I can't remember it, I remember in my mind that I would sort of write a business plan in my mind as to how I could do this, and where it would be, and what it would look like. And I drove around even through downtown Atlanta and inner city, different parts of Atlanta, kind of looking for where could the Good Samaritan Health Center be. Now, I didn't use that word or that title or name, but basically you get the idea. Where could this health clinic be? And never could settle on a place or a time or anything like that. But then, in the fall of 1994, I had the opportunity to get involved with a place called the Techwood Baptist Center. It doesn't exist anymore. It's on Techwood Drive, which is right through the Tech campus, but it was on that south end of Techwood Drive, right next door to the Atlanta Union Mission. The building is still there, but the church doesn't exist anymore. I had heard that this pastor was involved in inner city ministry, and I wanted to go meet him. And I said, if God is calling me to be involved in some kind of inner city ministry, I ought to get involved in some inner city ministry somehow. So that was my contact. I didn't know anywhere else to go. So I went down there to see if there's some way I could get plugged in. That was one of my motivations, to meet him, somewhere get plugged in. And the other reason I went down there was to try to adopt a family for Christmas. So that my kids, I have 3 kids. One of them was a little bitty baby at the time, but the 2 older ones I wanted them to learn something. I wanted them to take their own money, and go buy 2 gifts each, a kind of a toy gift and then some practical, a good gift like clothing for a family. So I went down there, I met the minister, and I was able to do that. We adopted a family for that Christmas. My own kids went and got stuff for them, and then we went down there and let my kids meet them and give them their gifts, expecting nothing in return but a thank you. Right? That's always hard to do, when you're little, because everything's given to you, right? It doesn't go the other way. But my kids, I think, learned a little something about it. At least I did anyway. Okay. When I was down there visiting the pastor of the church, I did not know this when I walked in the church. I promise you, I did not have an inkling about this when I walked in the church. But he starts showing me around the church and taking me upstairs. And upstairs, they have a small medical clinic. I did not know that at all when I walked in that place. And honestly, that was in December of 1994, when I walked in there and saw that, I truly, truly sensed in my heart and my spirit that this is where I need to be. And that was my jumping off point. And so in the summer of 95, about 7 or so months or 8 months later, I started working down there. I became their medical director. And that was my beginning. So then Good Sam was opened, about 3.5 years later in January of 1999. And I won't bore you with the details of what happened in that 3.5 years. But that was really the jumping off point for me. So the motivation was there, and then the opportunity presented itself. And then from there, we divested ourselves basically of the church, and then went out on our own and started Good Sam. So that's the motivation, and that's a short, maybe 2 elevator